Marques. My name is Kevin. I'm one of the Rehab Techs. We're going to be going over how the TENS unit works today. So we're going to be putting these pads on his cervical region where he's having the most pain. We generally like to place the pads either above and below the pain or left and the right, so not directly over the point of pain. You can really use the TENS unit as often as you like. We try to use 15-minute increments anytime that you're having some soreness or some stiffness. Any type of pain, we can have you on this TENS unit. So this is our next wave unit. We turn it on. We have one unit connected. We're going to hit our TENS button here. This clock button is going to adjust the timer that we can use for. So we're going to scroll through so we can hit 10 minutes. All right. So over here, 10 minutes, and we'll start to ramp it up. And on our case, let me know when you start to feel a pins and needles sensation.
Okay.
Okay, you start to feel it. So if this is the level where you're feeling it, and this is your pain threshold, you kind of want to be right underneath it. We shouldn't be making a painful face when you're going through this. So let me know if you want me to stop.
All right.
Right here?
Fine, yeah.
Okay. So at this point, I can put this in your pocket or leave this onto your belt, and you can continue to do your exercises as you wish, or you can just kind of hang out and doing some holding. But these are something that you can use as often as you like, just to help with the pain and help with the soreness.